Cancer survivors often suffer from chronic fatigue. In fact, fatigue is the most reported persistent effect of cancer therapy. More than nausea, we hear a lot about nausea, we hear a lot about pain, and those are frequently present in people. But the number one complaint is fatigue. And a lot of patients assume that, well, I just need to get through this therapy and then the fatigue will go away. Most of the time that's true, but in 1/3 of patients, the fatigue persists even after you've completed chemotherapy. And in some cases, it lasts for years. And that's a problem. Obviously it negatively impacts the quality of life. It could affect your ability to work and earn a living. It could affect your ability to perform activities of daily living independently. And that could be particularly important for older people who already may be having difficulties maintaining their independence. So how do we combat cancer-related fatigue? Well, in some cases, participating in a yoga program may lead to significant improvement in reducing fatigue and increasing a sense of vigor. So in this study, it was a 12-week program. They had 2 equal groups of people, cancer survivors. And in one group, they participated in a 12-week program of yoga. And the other group just had education classes, healthy living and lifestyle classes, that kind of stuff. And then at the end of 12 weeks, they gave them questionnaires, and they were kind of standardized questionnaires that gauge fatigue and gauge a sense of vigor. And what they found was that the group that participated in the yoga had significantly reduced their sense of fatigue over that 12-week period and increased their sense of vigor. Just a simple thing of participating in a yoga program, not highly stressed. It helps. Starting with yoga may also be a way to kind of ease your way into an exercise program. You may be so fatigued that, the thought of starting an exercise program may be just too much to start with. Well, starting with some yoga classes may be a good kind of segue into starting an exercise program. So clearly it's important to stay physically active, but physical activity is not necessarily the same as exercise. So I see a lot of patients and they tell me how busy they are, but they're not breaking a sweat doing anything that they're doing. Physical activity or exercise is planned, structured, and repetitive physical activity. Cancer patients can quickly become very physically deconditioned. It doesn't take a very long time to become physically deconditioned. And it's now becoming recognized that cancer patients need something akin to cardiac rehab. Call it what you want, cancer rehab. At Novant, they're trying to get together what's called cancer wellness. Unfortunately, although we have more and more data that suggests that such programs benefit patients, getting them back to normal, better quality of lifestyle, getting them back to work, that insurance, unfortunately, doesn't support that. Sometimes it's hard to get patients in cardiac rehab, too. And so right now, a lot of these programs depend upon foundational support in order to fund them. But that is something that you're going to see more and more of down the road.